O agglutinins are detected using dash tube. Option A, Felix. Option B, Dryers. Option C, Durham's. Option D, germ tube test. Answer is option A, Felix. Loose fluffy clumps are shown by option A, O agglutinins. Option B, H agglutinins. Option C, blocking antibodies. Option D, VI agglutinins. Answer is option B, H agglutinins. VI agglutinins is used to detect option A, carriers, option B, past infection, option C, recurrent infection, option D, recent infection. Answer is option A, carriers. Which is true about viral reaction? Option A, antibodies to H antigen appear first and persist for long time. Option B, antibodies to H antigen appear last and persist for long time. Option C, antibodies to O antigen appear last and persist for long time. Option D, antibodies to H and O antigen appear simultaneously and persist. Answer is option B. Typhoid detection in a patient on antibiotics is by option A, Vidal test, option B, blood culture, option C, fecal culture, option D, urine culture. Answer is option C, fecal culture. Presence of antibodies to against TO, AH and BH indicate option A, recent infection, option B, past infection, option C, recurrent infection, option D, vaccination. Answer is option D, vaccination. Commercially available O antigen for viral test is option A, blue colored, option B, pink colored, option C, green colored, option D, white colored. Answer is option A, blue colored. VDRL test is a option A, slide agglutination test, option B, slide precipitation test, option C, slide flocculation test, option D, tube agglutination test. Answer is option C, slide flocculation test. In VDRL test, serum is heated at 56 degrees Celsius for 30 minutes to option A, destroy trypanosomes, option B, inactivate the antibody, option C, inactivate the complement, option D, to destroy contaminants. Answer is option C, inactivate the complement. In RPR testing, option A, complement inactivation is not required. Option B, macroscopic flocules are formed. Option C, plasma can be used. Option D, all above are correct. Answer is option D, all above are correct. Fluorescent dye used in FDA ABS test is option A, acridine orange, option B, rhodamine, option C, auramine, option D, fluorescent isothiocyanate. Answer is option D, fluorescent isothiocyanate. Antigen used to sensitize RBC in TPHA test. Option A, Nicole strain, option B, Lancefield strain, option C, Reiter strain, option D, Pertinu strain. Answer is option A, Nicole strain. Dark ground microscopy is required for interpreting option A, FDA ABS, option B, TPI, option C, TPHA, option D, VDRL. Answer is option B, TPI. Standard agglutination test is for the serodiagnosis of option A, typhoid fever, option B, typhus fever, option C, brucella, option D, bacillus. Answer is option C, brucella. ASO test is an example of option A, precipitation test, option B, neutralization, option C, agglutination test, option D, complement fixation test. Answer is option B, neutralization. Streptococcal infections can be diagnosed by option A, streptozyme test, option B, anti-high hyaluronidase test, option C, anti-DNase B test, option D, all. Answer is option D, all. Blocking antibodies in SAT are option A IgM, option B IgG, option C IgG and IgA, option D IgM and IgE. Answer is option C IgG and IgA, which is not a heterophil agglutination test. Option A Streptococcus mg agglutination test, option B Rose-Waller test, option C Paul Bunnell test, option D Weil-Felix test. Answer is option B Rose-Waller test. Antigens used in Weil-Felix test. Option A Proteins vulgaris OX2, option B Protease vulgaris OX19, option C Protease mirabilis OXK, option D all of the above. Answer is option D all of the above. Which is not a standard test for syphilis? Option A VDRL test, option B RPR test, option C Wassermann test, option D TPI test. Answer is option D TPI test.